Next thing what can happen is there can be formation of polyp, endometrial polyps or endocervical polyps. At that time what they can do is like they can do a DNC or a DNE, or they can do a polypectomy. The physician can very well insert a device and then he can take an endometrial biopsy, or he can also do a endometrial polypectomy. This can also be done via hysteroscopically with the aid of a guidance. An endoscope is inserted into the uterus. What you need to know is whether the procedure is done as an open technique or as a hysteroscopic technique or as a laparoscopic technique. That is very much needed. So we saw endometrial curettage or DNC. What is DNC? Dilatation and curettage. DNA is dilatation and evacuation. So the hyperplasia of the endometrial layer. Uterus is again into various layers. The innermost layer is called as endometrium, and it is a shedding of the endometrium which results in the menses. And then we have the muscular layer called as a myometrium, and then the perimetrium. There are conditions like prolapse of the uterus or adenomyosis where the entire endometrial layer gets hypertrophied, or there is something called as endometriosis where it is a painful condition where there occurs formation of chocolate cysts. At that time, the patient might have excessive bleeding or menorrhagia, and the physician advises them to go for removal of the uterus, which is called as hysterectomy.